MD Anderson has opened up a new place, a clinic called the MD Anderson Cancer Prevention Clinic, where if a woman is a high risk woman, let's say she has lumpy, bumpy breasts, and she gets a biopsy and it comes back lobular hyperplasia. Well, we know that woman has 12 times the increased risk of breast cancer. But if you and I were to recommend to her progesterone and iodine, we could probably reverse that and clean up her diet and look at a number of other factors. We could probably, in a very short period of time, get her out of those dangerous guesstimate statistics. But what they're doing for these women is they're putting them on tamoxifen for 5 years. They're treating people now as though they have cancer to avoid getting cancer. And that's becoming the standard of care. And that is really making me extremely nervous. I mean, we are constantly, it's like the way we're pushing vaccines on pregnant women, you know, untested molecules, which is what happened to me. My mother had molecules that were untested put into her body, and then I couldn't have children. I had multiple cancers, and here I'm sitting having this conversation with you. It's very, very dismaying. And Craig Jordan, you know, before tamoxifen was put on the map by Craig Jordan, before then, metastatic breast cancer was treated with estrogen.
Yeah.
It was treated with high dose estrogen because hormones don't work like carcinogens. Carcinogen, the dose is the poison. So as you get a higher and higher dose, you risk more and more adverse DNA damage, which is the initiator of cancer.
Right.
But with hormones, as you get higher and higher, you turn off the system, you downregulate the system.
Right.
So they used to give high dose estrogen to treat breast cancer. And they only use 6 milligrams. Move over Suzanne Summers. But so
That's right.
It's crazy. But the biggest, so this whole tamoxifen thing, I'm very, very worried that tamoxifen is going to start being recommended to many of our daughters, our young girls, if they just have lumpy, bumpy breasts, or if they just, you know, have irregular menses. And we are now seeing less and less normal hormone levels in younger and younger females and males because of plastics and many endocrine disruptors in our air, food, and water. And Harvard has been publishing, along together with the neuroendocrine unit of Mass General and psychiatric journals, they've been publishing, looking at young girls 13 to 24 who have irregular periods. So they should, you know, the regularity of your period translates a lot into how healthy you are. And it's hardwired. It's biologically hardwired. And when it starts to change, something's up. So if a woman's having irregular periods, they've started to do deeper dives. And a lot of times these young girls, especially athletes, because young girls now do a lot more athletics than they've ever done, they have osteopenia and they have anxiety, insomnia, body dysphoria, gender confusion, and the area of the brain that has a lot to do with higher executive functioning, which is ruled a lot by estrogen, is shrinking. So Harvard and the Neuroendocrine Institute has published a 1.5-year randomized trial where they were giving hormone replacement like you would to a 60-year-old woman to girls 13 to 24, because when they tested them, they had no estrogen, hardly any progesterone, a smattering of testosterone. So they just gave them hormones. And all in all, the group that were given hormones got rid of their anxiety, got rid of their insomnia, got their bone density normalized, and their brain, with functional MRIs, the volume of their brain normalized. So a lot of us are in a hormone mess because the planet is filled with all these hormone disrupting chemicals. My book, Hormone Deception, in the last third of it, shows how to decrease exposure in your home, where you get most of your exposure, in your supermarket cart, in your office. So I don't know why gynecologists aren't very intent on helping women who want to get pregnant learn how to decrease exposure, because you'll have healthier children and grandchildren if you can learn about all this. But they're not on the road. They're handing out birth control pills, and they're dissing hormone replacement. I know, it's very upsetting.
If only our system was like that. And
And no one wants to lose their license. Everyone's fearful of losing their license, so they want to color within the lines. And when I lectured in Chicago a few months ago to it was about 120 docs, there were 20 gynecologists in the room. And I mentioned the reanalysis of the Women's Health Initiative and that the estrogen only arm was never found to have caused any increased incidence of breast cancer. None of those gynecologists knew that information. None of them. And when they came up and we chatted, we went to dinner and they said, we never hear anyone who knows all this data. We just learn what we learn, and then we go off and we do procedures and we work and we go home with our families. And there isn't any more deep dives into going beyond what they're told. And of course, you get scared to go beyond what you're told because you've worked so hard. You don't want to lose your license, understandably. But we're in a pickle. The American human being to stay healthy is in a pickle of who to go to. And so we're lucky that we have doctors like you who are trying now to be an agile thinker and look at the science, really look at the science. Now, it's very confusing because people can say, look at my science. No, look at my science.
That's right. And COVID has shown us that, where science can also become very tribal. So.
Oh, I like that statement. I like that. Science can become tribal. That's exactly right. Did you make that up? That's a really good statement.
Actually.
That's great. I like that.
So, and this is why these conversations are so important is we really need to, I've been woken up to this reality. I think a lot of other patients and clinicians need to be woken up to the way that you were taught in med school is not what the science tells us and is not, or should not be the standard of care. And so I'm glad that we're having this conversation.